Hi, it's Dr. Reed Lerman, and I'm here with my patient who's going to introduce himself to you in a second. And we're going to talk about his treatment with the DRX 9000 and the K laser, and how he did with that and what his experiences are like. Why don't you introduce yourself, Ed?
Hi, my name is Ed Zammit. I'm from Vienna, Virginia, and I was introduced to this whole system this past summer from about, I guess, July to about August. I did about 10 treatments. This is my 11th, and I'm back here in, of course I haven't been here in several months, so I decided to come here. When I came here I wanted to make sure I made an appointment, and here I am. So.
Tell me, what is it that you, brought you to see me the first time? What were your complaints? What were you suffering from? Kind of describe how life was like for you prior to getting your care.
Well, my back pain, it could be debilitating in the morning. I'd get out of bed, I would have to go right to a door to try and lift myself up so I could stretch my back. I've been to chiropractors. I have devices that I use, and they've kind of limited the pain, so to speak. But occasionally my back would go out, and this would happen maybe once every 2 months or so, and I wouldn't be able to go to work. I'd be in pain. The only thing I could do was just wait or try to work it out myself with different devices. Now I've had the last treatment since I've been here, okay, has been I think sometime around the end of August, and now it's the end of November, and this is the first time I've been back. And since that time, I've gotten out of bed. Haven't had, and some mornings I have not had any pain. Keep in mind I've had 10 treatments, and I've been able to actually take my 4-year-old, throw her up in the air and catch her. I can do work normally around the house, lift heavy objects without any pain for several days. It would probably last about a day. I mean, it's not perfect. I'm not 100% there yet, but I'm about 40% better than what I was before, which is a big improvement, because I can actually live my life a little bit better. Okay, I don't know what it would be like to get the full 20 treatments. I've had 10. Well, counting this one, it's been 11. So I don't know how it would be, but I've also had a problem with my big toe. I was told that I would probably need an operation, and they had the operation all set so that they would basically, the cartilage is gone between on the major joint in my big toe, on my right big toe. So they were going to operate and put a metal brace on the toe, a permanent one, embedded in the toe. And I had second thoughts about it. The doctor said, "You will be back." And since then I've had the laser treatments, okay, with Dr. Lerman, and it's worked. I mean, I'm not Superman, okay, I can't, I've given up running, but I've given that up a long time ago because of my right knee. But at least, you know, I'm able to walk around. I don't have pain. The swelling is gone. It's controllable, very much controllable. And at that time I thought I would need surgery. I've been very pleased with this, and if I was living in the area I would continue to do the full 20 treatments, and I would continue doing it. One instance I can remember, after the 4th or 5th treatment, normally if I bent over for an extended period of time and I tried to get up, I could expect some pain. After about the 4th or 5th treatment, I went underneath their house, okay, bent over to grab something underneath a crawl space. Came back up expecting to get up and feel the pain. Didn't feel anything. Okay, but that just gives you, that's just an indication. So at that point I knew that this was actually working. That's my story.
Excellent, very good. Well, we had discussed a few things before getting up on camera that I think might be helpful for anybody who's viewing this to understand. Prior to this, we had talked about pain was pretty much a daily occurrence for you, a daily thought on your mind. And at this point, correct me if I'm wrong, it's not?
No, it's not. I get up in the morning, I may feel a little stiffness sometimes. Sometimes I don't feel anything at all. But right now, it's not a daily thing. I mean, some days I go through some days with no pain at all. It's almost like I have nothing. And I think, and that's what, and I think about that. Okay, when those days come about, I'm thinking, you know, it's noticeable that there's no pain at all.
Excellent. What were things that you were limited in prior to you getting the care when the pain was bad? What activities would you be prevented from doing? What things would you like go, I don't want to do this, I'm going to really have a flare-up, or I can't do this and I would like to?
Well, lifting up my 4-year-old for one thing. Okay, that was I'd lift up my 4-year-old, I'd walk a few steps, or I'd have to walk across the street or do something with her, you know, and I knew, you know, that it was going to be a problem. And it normally was. Now I don't even think about it. I'm lifting her up all the time. I'm throwing her up in the air.
It doesn't get better than that, huh?
No.
You're going to play with your child.
Oh, no.
That's excellent.
No, I've been, like I said, I've been very pleased. I'm not getting paid for this video. I just, you know, I'm very satisfied, and I just want to, and Dr. Lerman's been, you know, very patient, and he's given, he has no problem spending as much time as possible with me to any kind of aches or pains that come up, every visit I've been to. So I'm very pleased to do this video for him.
Thank you. I appreciate you doing it for me. Your diagnosis, we had a degenerative disc at L5, is that correct?
Yeah, L5, the lowest disc in your body, basically.
Yeah, it was significantly degenerated.
Right.
And how many years were you suffering with prior to getting the care? Was that an issue for you?
I would say, probably the past 20 years. And I remember I'm 57 years old, so this happened when I was in my, I would say probably early 30s, late 20s. You know, I don't recall the exact incident. I believe it was, I was in the beach, body surfing, and the waves were really heavy at that time, and I think I landed on my chest and my back arched, and I felt something. Nothing. I didn't think much of it after that. Being young, you don't think about it. But it got to the point where I was not able to. My back would go out, and I would have to crawl out of bed. I was able to keep it under control. It was never that bad after I learned that I needed to exercise and strengthen my back and my waist, but it was always there, and it would come back with a vengeance occasionally. I haven't had anything come back since the treatment, these treatments.
Great. Anything else you want to add? I think you pretty much said a lot there.
Nah, I've said everything. That's all I can say. I mean, I highly recommend it. I mean, for disc problems, I really highly recommend it, and I recommend the laser. Actually, I'm here now basically because of another problem I have with my Achilles tendon. That's the reason I set up this appointment. But Dr. Lerman gave me the whole treatment, which was what I really wanted. That's it.
Thank you very much.
Welcome.
Thanks for sharing your story.
Thanks for your help.